Good afternoon, my name is Niyam Yakub.
I'm Felicia Beggy.
And I'm Nicole Kahusai.
And I'm Erin Javier. And today we are here to talk about correctional nurse. Our objectives include scope of practice, education and training requirements, necessary skills and duties, teaching and learning strategies for prisoner population, interaction between disciplines and professionals, and also what we learn as a group. For educational requirements, correctional nurse needs to have a certification, diploma, associate degree, or bachelor's degree in nursing. Registered nurse license or licensed practical nurse license is important for this. Other optional certification includes Certified Correctional Health Professional Certification, continuing education related to correctional nursing can be very helpful for this field. Obtaining trainings in medical surgical unit as well as emergency unit can be very beneficial. The next topic that we will be talking about is the scope and standards of practice. There are 16 standards of correctional nursing practice. The first 6, assessment, diagnosis, outcome, identification, planning, implementation, and evaluation, are used in the nursing process. The next 10, including the ethics, education, evidence-based practice and research, quality practice, communication, leadership, collaboration, as well as professional practical evaluation, research, utilization, and environmental health are roles of nurses in the correctional settings. In this type of setting, communication and collaboration in providing safety and effective patient care is very important. Standard 16 on environmental health is a new standard and requires the correctional registered nurse to practice in an environmentally safe and healthy manner. Our next presenter will be Nia.
Hi, my name is Nia, and I'm going to go over the necessary skills and daily challenges of a correctional nurse. Correctional nurses perform many skills that registered nurses or nursing professionals do. They assess, they treat, and medicate their patients. They monitor the patient's progress and responses to medical treatments. They properly document their medical history as well as what medications they're giving to the inmates. They do have more independence due to their work environment and also because they have less staff. They also have fewer supplies, so they have to use more of their assessment skills. They also have to maintain proper safety procedures, and what I mean by that is they have to make sure that they don't leave any type of IV injections or needles hanging around where the inmates can get hold of that. So also any type of dangerous materials they cannot leave around, like IV drips or scalpels. So you just have to make sure that you're following proper safety procedures. So even though they're trying to, correctional nurses are providing optimal care for the inmates, they just have to also follow safety procedures. So as far as the clinical skills go, correctional nurses are the first healthcare professionals to assess the inmate's condition. They could go from minor discomforts to life-threatening emergencies. So, these patients can present with many types of healthcare problems. Also, they could be reoccurring problems that they're faced with. So the correctional nurses have to know to make the right decisions and know the correct actions to take, and also assess the urgency of the situation and get a doctor in there if needed. So that, that gives them a lot of autonomy as far as taking care of their patients. And by doing this also prevents delay in care and improves the patient's outcome. Correctional nurses face many challenges while working in a correctional facility. They have to maintain safety as well as provide optimal care. Their working environment is a lot different than the hospital setting. They have limited equipment. They don't have any windows, so the rooms are much darker and much more crowded. Correctional nurses cannot share any information or carry any personal belongings with them while they're taking care of these inmates. that includes a cell phone, which most of us are glued to. Even in a hospital setting, sometimes we just stick the cell phone in our pocket and go on with their day. But for a correctional nurse, they can't bring any of that with them while they're taking care of these patients. Another thing that can be challenging for correctional nurses, like, while in a hospital setting, they encourage you to bond with your patients using, empathy. For example, before you leave your shift, you might hug your patient goodbye or share a personal experience with them. Correctional nurses, like I said, cannot do that. So for them, it's hard to show that empathy, and you have to maintain a professional role at all times. When it comes to privacy and teaching, inmates are not provided with the education in a quiet, calm setting that you would expect, like in a hospital setting. You can't shut the doors behind you. People, and if you are in a room, people are constantly in and out during the session that you're having with your patient. Correctional nurses also have to do multiple intake screenings to ensure that all the medical conditions are documented and any emergent health needs are met for the inmates. It's a 4-page document, and their physical and mental history is noted. Also, lab work is done on site, and medications are provided by the state pharmacy. And correctional nurses also have to coordinate outside services for the inmates when they get discharged. So they have to pretty much involves coordinating with the correctional department to arrange for continued care and medications on the outside. So as you can see, correctional nurses have a very busy workload. And now Nicole will be talking about teaching and learning strategies.
I'm Nicole, and I'm going to be discussing the limitations with teaching and learning for this inmate patient population. The correctional nurse has limitations as far as providing privacy and adequate time for teaching. For example, on a 14-bed unit, there are only 2 officers among the nurses to share, making it very complicated when it comes to teaching in this setting. The inmates have a low readability level and health literacy. The inmates' mental capacity and learning disabilities may interfere with the teaching, and there are language barriers and educational background. Mental illness may be a factor as well when it comes to teaching this population. Inmates with mental illness are especially vulnerable. Many times they have depression, mania, and other psychotic disorders, which are undiagnosed, untreated, or not treated at all. The inmates' backgrounds are already at a disadvantage with a history of physical abuse sometimes, leaving them with PTSD or traumatic brain injury. They have drug and alcohol abuse, leaving them with poor impulse control, self-injury, and aggression, making it more difficult to learn for the correctional nurses, from the correctional nurses, and vice versa, harder for the nurses to teach this population. The literacy of the inmate population is something to take into account. Many of them are unable to read at a basic 5th grade level. They have low health literacy with little to no health knowledge, and they are burdened by chronic illness, and they are also less likely to use preventative health services. Some teaching and learning strategies to keep in mind. It is important to check readability of the materials, use their primary language, avoid medical jargon, assess their readiness to learn. If a doctor's just come in and given them a positive HIV reading or a positive biopsy of cancer, that's probably not the best time to teach. It's important to ask open-ended questions, avoid questions that are yes and no, and provide a later opportunity for answers. Correctional nurses can improve the health outcomes through the use of appropriately skilled teaching materials. And next we have Felicia, who's going to be discussing the interactions between disciplines and professionals.
Hi, I'm Felicia. I'm going to talk to you about the interactions between the correctional nurse and the other disciplines. For physicians on any given institution site, there's usually only one physician available, so the nurse has to work very autonomously, making very important decisions using critical thinking, and have to be very confident in their decisions about the inmate. With social workers, the social workers are the go-between the inmate and the public in any kind of way. So if there's phone calls to be made to family or otherwise, if they are outside of the institution, such as in the hospital, that is for a social worker to do. The nurse is never to make contact with anybody outside of the hospital on a patient's behalf, or to accept any phone calls on a patient's behalf. In fact, it's confidential when when an inmate is in the hospital. Case managers are the go-between the payer and the doctors for inmates, making the same kind of decisions that case managers make with regular insurance companies. So I'm not sure that most people know that there's someone making decisions for their care, much like ours, outside of the institution. They have to have all of their procedures approved as well, and denied. Pastoral care is very different in an institutional setting or in the hospital for inmates. They don't have as many pastors available to them, and particularly of the different religions, and it's not as warm as it could be in a regular hospital setting. There's no touching involved, and there's no names used. The investigator, anytime there's a death, whether it's in the institution or in the hospital, they have to call the investigator because all deaths are a crime scene. The bodies are a crime scene, so they can't be touched. Everything has to be left intact on the patient. And the investigator comes and asks a bunch of questions and takes pictures. So the nurse is involved in all of that, answering the questions, going through the chart with the investigator. And once the scene is cleared by an investigator, then you can call the medical examiner, and they will come and pick up the body. All inmates have an autopsy done, regardless of the cause of death, and very few inmates are able to donate organs. Yes. As far as the other officers, correction officers, the sergeants, lieutenants, captains, majors, and wardens, nurses have to be very keenly aware of a custody level of a patient, because the custody level could be high, where they need 4 officers, such as death row inmates. They need 4 officers around them at all times for a nurse to care for them with a shotgun and a handgun readily available, which is kind of scary. You have to know what their custody level is to know how many officers to send away with them for procedures. So there's a lot to consider in patient care on an inmate floor, because you can't send them all off at the same time for procedures, so you have to prioritize who goes first according to how many officers you have available. So their care is limited, and sometimes the procedure that may need to be done one day can't be done for lack of officers. You have to know the different positions, the sergeants, lieutenants, the captains, and the majors, and the warden. As a correctional nurse myself, you have to know which one to go to for which particular event that's going on. The sergeants handle certain things like transport, and obviously the warden handles the major things. What did we learn? We learned that nurses' safety is very important in caring for an inmate. We are not allowed to divulge any personal information to the inmate at all, about ourselves, about our experiences, about our family, even if we leave out names. Certification for specialized nursing out. There's not a lot of people that knew that there's a special certification for correctional nursing. The living conditions of inmates. I don't think too many people realize that inmates live in light all the time. There is no darkness ever. The lights are on when they sleep, which is why they sleep with towels over their eyes or pillowcases. Most of the inmates that are institutionalized have substance abuse issues or mental disorders, making it very difficult with a dual diagnosis. We did learn that deaths are a crime scene and that there are different custody levels. Thank you very much.